On today's episode,
Savannah went the medical route. I went into law enforcement, became a paramedic, and along that way, we stayed best friends. And through those careers, we kind of found our way back to each other from a professional standpoint when we realized there was a little bit of a gap in one area of school safety regarding bleeding control kits.
A lot of people don't realize that uncontrolled hemorrhage is the leading cause of preventable death in ages 1 to 46. She brought one to me one day and she's like, what in the world? This is great. Like, I'm so happy that the school is doing this, but it's a bag of stuff that nobody knows how to use. And maybe this is something that we can use our skills to make better.
welcome back to Well Informed, where we break down the key issues shaping school safety, crisis intervention, emergency preparedness, and community resilience. Today we have not one, but two incredible guests with us, Dr. Savahanna Wagner and Officer Meg Soultz. Welcome.
Yeah, thank you.
So excited to have you both here on this podcast. We first met, really, was it in West Virginia?
I think probably, yeah, we'd seen some of the Safer Schools Together family at other conferences, but I think we met there and we're neighbors.
Yeah, exactly.
Yeah.
So it was really cool to meet you both, and I still haven't had a chance to actually see you both present yet, which is too bad. I was doing this for the middle of it, but your company, Rescue in Color, you both obviously had very unique career paths that led you to emergency response and public safety. So what kind of led you both to this career path now?
Yeah, so we were each kind of on our own paths. We've been friends for 20 years, and we met actually working on ambulances together as probably 19-year-old kids responding to 911 calls. And just as we took that path in public safety, Savannah went the medical route. I went into law enforcement, became a paramedic, and along that way, we stayed best friends. And through those careers, we kind of found our way back to each other from a professional standpoint when we realized there was a little bit of a gap in one area of school safety regarding bleeding control kits and how those were being implemented into the K through 12 space, and how we were educating our staff members, our students, on how to use those. And we just felt really compelled. She's a mom, which I'm sure she'll talk more about, but that's a big driving force for us, is like, what can we do to help make this school environment just a little bit safer in our own little area of expertise that we can share.
Right.
Yeah, we've done a lot of work in our previous lives before Rescue in Color, pre-hospital work, disaster medicine work, and one thing we talk about and we have taught in the past is triage, mass casualty triage, and a big principle of triage is start where you stand, and Meg was working as a police officer inside of a school, was implementing bleeding control kits in the school, which we loved the sentiment. But she brought one to me one day and she's like, what in the world? This is great. It's like, I'm so happy that the school is doing this, but it's a bag of stuff that nobody knows how to use. And maybe this is something that we can use our skills to make better. And that's really how Rescue in Color was formed, as taking these mandates that were coming down the pipeline. Schools were starting to jump on the train of getting bleeding control equipment and bleeding control kits, much like they've gotten AEDs. But when you have an AED, it's organized. It tells you what to do.
Yeah.
People aren't trained to use this stuff. And so we thought, well, maybe this is where we can start where we stand. It's a really small part of a really small corner of school safety, but it's a way that we can contribute getting this equipment in a well-organized way to people that might have to use it someday, and giving them a fighting chance to be able to use it and use it properly. Yeah.
So it's like a new and improved kit plus the training that goes alongside that?
Yeah, absolutely. We didn't reinvent the wheel with the stuff on the inside. There's really tried and true equipment that is successful from our partners in the military, law enforcement. We're able to see those things save lives on a daily basis. So it's not necessarily the equipment, it's the format that we can provide to help people understand how to use that. And Rescue in Color, our name, part of that is because we created a color-coded system so that people could follow along and understand better what piece of equipment do I need in my hands for this particular injury type, and then provide them some really simple instructions on how to use that equipment.
That's amazing.
Yeah, and the other thing we wanted to do was this can be a scary topic. You know, we already put so much on our educators. You know, they're the medical doctors that have to treat the asthma attacks, and they have to, teach our kids all of the curriculum, and they have to, our educators are so tasked with so many things. Then you put this on top of it. Not only is it anxiety provoking to even think of the idea of having an emergency like this, but then it can be an intimidating topic to people don't want to train about it. They didn't go become a teacher because they wanted to treat medical emergencies, so to even think about that can be really scary and unapproachable. And most companies out there, which are fantastic, and we stand on the shoulders of a lot of these companies, but you hear words like tactical and and those can be, we just wanted a way to soften it a bit, make it a more approachable topic, empower people to have it, to use it, to not be afraid to learn about it and use the equipment if they need to.
We got some really incredible feedback, and we kind of looked at each other and like, okay, I think we're doing the right thing here, because we had a teacher, as we were explaining the kit, tried to show it to them and give them a little bit of an intro. It was a teacher and said, I have so much less anxiety about this topic the longer you guys are talking about this. And for us, that was like, okay, I think we're doing something right with the way we're approaching this.
That's the validation that you need
Yeah.
to keep going. Yeah, it's really interesting because it seems like you're kind of taking it from a trauma-informed perspective, trauma-informed approach. Because one of the things when we talk about school safety is how we're using some of these words. Previously I was talking with Dr. Melissa Reeves and talking about threat assessment and how there's some misconceptions about what that is. And we were talking about emergency preparedness and how a lot of schools will use things like that hold and secure, or the lockdown. We've seen some school districts kind of even transition that language to, instead of a hold and secure, it's a hold and teach. It's just like simple things like that. So I love the idea of that color coded, because in times of emergency preparedness, or when there is that emergency situation, to your point, nobody's gonna, nobody gets into this education business to be able to respond to these things. And one of the things I've been beneficial enough in law enforcement, nobody, when there is that emergency situation, nobody rises to the occasion. You just fall back to the lowest level of your training.
Right.
So in those cases, right, when there is that time where you do have to respond, you do need to know, if those kits or whatever it is out there can be as easy to follow through and understand, then that's perfect. And for me, the colors is great because I'm a visual learner.
Yes.
So it's fantastic. So can you talk a little bit about the kind of elements of the kit?
Yeah, I think that's a great lead-in to, because the color coding is, of course, a major part of what we do, but we also wanted to remove barriers that we know as professionals and experts in the space. We know what happens to your body under stress. Fine motor control goes away, and to your point, you fall back to those really primitive senses. Those are the capabilities that you have in the moment. And so we incorporated, many people probably wouldn't even know that, like looking at the kit, but we really tried to remove any barrier that we could think of, just knowing what we know about how the body responds under stress.
Yeah, a lot of what we tried to do with our particular kit is even the bag itself without just the color coding system. So, you find, looking in a classroom, how can I put this out on display and it not be intimidating? And to make sure that the substitute teacher that's in the classroom is going to be able to find it in the event that the main teacher isn't there and something happens. So we magnetized the back of the bag, which is a unique feature that I don't know that you'll see anywhere else, so that you can post it up really anywhere you need to. We've got a bidirectional zipper that we've sewn in a loop, so you just grab a hold of the handles, rip the thing open, and it's going to open right up. Right. Because we know that fine motor control, you're going to lose that in a stressful situation. So we want to make those types of things as easy as possible. And then even down to the equipment inside, we have an orange section for tourniquets that addresses limb injuries, uncontrolled bleeding from a limb. The green section has gauze and compression dressings for wound packing. We call those junctions, but it's really just where your limbs meet your body, places that you couldn't put a tourniquet where you may have excessive bleeding. The blue sections for breathing, that makes sense to us from a color coding standpoint. And those incorporate chest seals for holes that are in the chest or the back. And then those extra tools that you need, like gloves and scissors, to be able to keep the rescuer safe and be able to expose the injuries and treat those appropriately. And prevent heat loss. There's a survival blanket in there as well. That's another key element that people don't realize. That's a big part of good outcome from an emergency department when you're treating trauma patients. So incorporating all those things and then taking a step back and even looking at what's the packaging of the equipment inside. You know, oftentimes you'll get something that's vacuum sealed or it's plastic wrapped, and it's like, okay, well, we can assume we're going to have blood on our hands, probably, if we're in this situation, unfortunately. So can I open that? Is that going to be easy for me to use? And so we've selected the equipment that we feel you can really get to easily when something like that's happening.
That's really great.
And then there's color-coded instructions, you know, those sections that Meg was describing. There's color-coded instructions that are easy to understand. We've focus grouped. Can I use that as that?
Sure. Yeah.
We've done focus groups on kids as young as 5. Wow. They need a little bit of help reading the instructions, but in giving them the instructions and only the instructions provided, they can put on a tourniquet properly. Might need a little help getting it tight enough, you know, things like. So there's some limitations for the younger kiddos, but the idea being we want to assume that somebody, of course, any training is better than no training, but we wanted to make the assumption that somebody could use this having never seen a tourniquet before.
That's awesome.
And where's the injury? If it's on a limb, go to this orange section, follow these simple instructions, and you've done your part, you know. So we really just wanted it to be that empowering.
Yeah, that's really helpful because just from my own experience, I had a little, stint where I'm super into emergency preparedness, like at the house, right? So I ordered this big, first aid kit off Amazon, and I looked inside and I was like, great, there's a bunch of things in here. No idea what they do. Thank God my wife's a nurse because she knows all what to do. But I look at that, I'm like, I wouldn't know where to grab or what to use in that case.
Yeah, and we see some of those things, and we'll demo some of those things too. Like, all right, first step, can you get this open? Now we've dumped out a pile of equipment. Can you get your hands on the right stuff? And again, under stress, if you're trying to solve a problem that you haven't been faced with before, it's really difficult to critically think your way through a problem when you're under stress. And we say that as people that work in stressful environments. So I can't imagine then having very little training, that's not your full-time position or your responsibility, and now you're being asked to perform this life-saving skill. So again, trying to remove those barriers and make it less intimidating.
Yeah, absolutely. So how did you two first initially meet? Because you said been friends for 19, 20 years?
Yeah.
That's amazing. So how did you two meet?
We started working we worked on the same ambulance service together in college. When we first started college, I hate to admit that I'm just a little bit older than Meg, just a year and so I was 2 years older than her in school. So when she came, I was already in college working on the ambulance service, and then when Meg started later, we just became best friends through that. Had the same, our social group was, kind of like revolved around doing that job. And so from a really young age, we were, it's kind of, to look back on where it all started, we were doing some really crazy stuff really young, like being faced with some really stressful, heavy thing, doing a pre-hospital medicine at the age of 18, 19 is kind of an ask, but we've carried it through, we both stayed in the field, and it's brought us together, it's always been a part of, it's how we came together, and then we finished college, we went to grad school together, and she went the law enforcement route, and I went to medical school. But we've been friends the whole way through it. So
Nice.
when she brought the bleeding control kit home from the school that she was working in, it wasn't like let's solve this problem, let's talk about this professionally, because we were at that point, like of course we both had jobs, whatever, but we were friends. Like that was, we were just friends. She was like, look at this thing, this is
It's
what
more
am
of
I
like,
gonna
can you
do?
believe this?
Yeah,
type
yeah,
thing?
yeah. It was sort of like a friendly conversation,
Yeah.
and like we were just talking. She obviously was a doctor, and she was like she. As a unique position as a police officer, because she's a police officer with an advanced life support medical training. So there's lots of police officers that are EMTs or get some kind of EMS training. But being a paramedic, she's a especially good asset to the police department, and so she's often in charge of a lot of the training at a couple of the departments where she's worked. She takes on that role there. So then, of course, they tasked her with incorporating these bleeding control kits, and we have already talked a lot about teaching and that kind of stuff, or we've just talked about it as a mutual interest between the two of us. And so it started off as just oh man, I gotta put these in every classroom, and how in the world am I gonna teach the teachers how to use this, and what am I, it was more of just a friendly kind of conversation. I'm like, we could do something a little bit better. And
once we pivoted though to that path, then not long after we'd started trying to brainstorm and figure out how we were going to tackle this or make this more approachable, the Uvalde tragedy happened. And, with her having young kids, then it was almost like we joke because we remember very specifically Savannah reaching out to me once that news broke and saying, we're not working fast enough.
Right.
You see something like that and you feel so called to do whatever your little piece of the school safety part of it is. And so for us, that's these bleeding control kits, and realizing like there's a lot on the line and we need to work faster so that we can make sure we get this equipment out to places that need it.
Yeah, because a lot of people don't realize that uncontrolled hemorrhage is the leading cause of preventable death in ages 1 to 46. And it was, we had, to echo what Meg said, we had, started this journey of trying to, we called a manufacturer and said, a question, how do you get something manufactured? Like, what do you get,
Yeah.
And luckily they were incredible. I think when you start a project like this, one thing that we've been really surprised, we both are professional women, and we've been through a lot of school and but we've never tried to do anything that hasn't been done before. And so that was a new experience for us. And one thing we've been really pleasantly surprised is so many people are willing to help if you don't know how to do something, if you ask the right questions and you're nice. And so we called and said, hey, a prototype of something. First of all, what exactly is a prototype? Second of all, how do we get it made? And they were awesome. And so we had kind of started some, and it was fun is maybe an insensitive word, but we were feeling good. We were feeling good about what we were doing, and it was something we were doing outside of our jobs that we felt like, this is gonna make a difference, and we're gonna get these into the school where she was working and my kids' school, and that's kind of where our mind was at the moment. And then, like Meg said, I heard the news like everybody else about Uvalde, and it was that we often look back at that day as just things changed for us.
Right.
Like, okay, we still believe in it, we still believe there's a gap, but this just is something we're gonna put our heads down and do bigger, do faster. We can have a further reach than our own backyards, hopefully, and we're not doing it fast enough, so let's get to work.
Yeah. How many schools are the Stop the Bleed kits in?
That's a hard question to answer. I think we're in 14 states now. So
Awesome.
Schools all across the United States. This is our first trip up to Canada to make it an international project.
Yeah.
But
yes.
yes.
We do have some in the Philippines. We had a guy
Oh, yeah,
buy
yeah.
him to
That's
bring in the U.S.,
Yeah.
but his intention was to bring them to
Amazing.
Philippines. So, yeah.
And then once you realize like this is more of a life skill, and we often talk about it in this big, bad, scary, like active assailant framework, But really, accidents happen anywhere and everywhere, and it's usually not violent related. It's usually an accident of some kind where these things need to be used. So then we found people wanting them in other places outside of schools, like churches, event centers, airports, so some of those places.
That was going to be my next question, because these seem to have such versatility, just like these AED kits that should be everywhere. So has that kind of expansion started to happen?
Yeah, it has. And in really natural ways almost, we would go talk to somebody, a school nurse or a school resource officer, and trying to explain to them what we were doing and why, and gauge their interest. And oftentimes we would get like, hey, actually, do you care if I pass your information along to this person? And then, we'd get a phone call the next day from, a different church that's the dad of the school nurse. And so just really organically, it started to spread to other areas. Our passion and our heart has always been with schools, and that being the primary intention, but we found a lot of utility in other areas.
Yeah.
It's relevant to, celebrating being here in Canada. One of our biggest interests, really, we're located in Minneapolis and Minnesota, so we share in common the love of hockey, of course.
Nice.
And so you see a lot of injuries, like a lot of skate injuries.
Right.
So we have a lot of ice rinks that have reached out and have, incorporated our kits. That's a big,
And we've
big interest. And
had to restock some of those.
Yeah,
they
those are where they get used, unfortunately. And so, like Meg was saying, we say in our trainings a lot, it's often talked about in this context of violence and active assailants, but we tell everyone, you're probably not going to use it, actually. And that, the chances of you using it in an accident or a skate injury or shop class or something, is much more, is a much, there's a much higher chance of that.
Yeah, absolutely. So kind of take us back to the, inception and starting these. Obviously with backgrounds that span medicine, EMS, law enforcement, how are those different perspectives kind of shape the way you approach emergency preparedness?
Yeah, I think kind of we have an understanding from start to finish of what an emergency looks like. And I guess to expand on that a little bit, there's a 911 call that gets made by someone, either the injured person or someone that's standing by that person. And so then having a really intimate, detailed account of what's the timing like, how long does that phone call take, and where are they calling, and who's the dispatcher they're talking to, and what capability does that person have to give instructions prior to the arrival of emergency responders. And then how long is it going to take me in my squad car to get there? And is there a threat as law enforcement once I get there? Because unfortunately, I can't run right to the aid of those that are injured. You have to stop and make whatever safe it has caused the injury in the first place. And then have I now made the scene safe enough for the EMS personnel to come in, and understanding the capabilities of the EMS crew, and then transport to the hospital, and then the longer term effects with Savannah in the hospital receiving those patients. So I think just from kind of start to finish, we've been able to work firsthand in each of those areas. And then not only that, but Savannah has great experience with emergency preparedness, with working with a healthcare coalition for the city of Indianapolis, and making those plans and forming and starting those conversations with people ahead of an emergency or an incident. So we've been able to kind of take this at each of those angles, and because of that knowledge and those different areas of expertise, we can also connect with people in a different way. And really, that's the big piece is can we connect with people in such a way that we can empower them and make them feel that they're going to be successful.
Awesome.
I think that's something that we've realized through this work, I think through the work we were doing before, but also through this work, is there's a lot of people who come to us and say, I don't know, I don't think I could do this. I would be really scared to do this. And then you meet people where they are, right? But we have learned that people will show up when they're called, and we just have to show them that, so we love to do trainings with teachers, and because we can show them that that they're capable of so much more, and what we've learned about just the human condition in general is people help, people help, they want to help, people don't want to feel helpless, they don't, as much as you think in a normal, like, a conversation, like, I don't think I could, well, if I saw somebody bleeding, I don't think I could put on a tourniquet, but then when that time comes, that's the first person, especially people in this, who are educators and who are already serving, are already public servants. That's just what they're kind of called to do, and we just have to show them that. Michelle Gay often talks a lot, from Safe and Sound Schools, talks about being prepared and not scared, and so we use that principle. That you don't have to be dramatic in your simulations and stuff to do, you can learn these skills without it being a stressful, scary thing. So we just want to show people that and bring it out, and we encourage schools and anybody who has our kits, like, sure, the physical product is a kit, but you really need a program, you need a program, you need a culture around it. So we do a lot of training. Our kits, we have a quick orientation video that just is with the kid. It doesn't replace like a full training, but just here's what everything is inside. We really think a comprehensive program is more important than just throwing some equipment in a classroom.
Yeah, part of that comprehensive approach too is having an understanding of each of those pieces, even in terms of communicating that out to the communities that these kits are in, right? Because if nobody knows they're there, then they're really hard to find or use. And so we've learned through the years and through our own experiences and otherwise of, okay, we need to include dispatch in this conversation, and can I put an address alert on file for this address so that the dispatcher can tell the caller, the 911 caller, that this is available and here's where to find it, much like they can with AEDs, and making aware the police departments, the fire departments, the EMS providers, hey, if there's a big scene where there's a lot of patients and you need more equipment than what you brought with you, here's where you find these. Because not only can the first responders, those people that are there when the injury occurs, but the first responders that are showing up as a result of that 911 call can still use, it's still the same equipment that we carry on the ambulances. So just providing that in a way that it's useful and accessible for everyone.
It's really interesting you shedding light on a lot of the things that I guess would surprise people that go on kind of behind the scenes when there's a large scale emergency. What are some other things that kind of might surprise people that actually go on?
One of the things we talk about in our training is to make sure that you have an awareness of where you are inside any building that you're in. People kind of wander about their day and maybe don't pay as much attention to that, which might be good. I don't know. Maybe I'm hypervigilant. I'm not sure. But, even things like we tell them even if it's a large-scale incident and that help is on the way, if you're not sure that somebody knows that you specifically need help in this particular location, call 911. Because we may show up to a large-scale incident and know that people need help and they need care, but we may not know exactly where you are. And so some of that information is even eye-opening for people of like, oh, well, I thought if I just gave the address of the hotel that we're staying in that somebody would be able to find me. No, where are you? And where are the people that need help? Because that's information that can get lost in translation sometimes from the initial phone call to dispatch, then coming into the radio.
Right.
It's not always in these big incidents, it's not always a linear process, right? We think of the first step being to call 911, but it surprises a lot of people to know, or maybe not surprising, but they don't think about that those dispatchers are the ones who have direct access to the rescuers. So if you think that, well, 911 has been called because I know the police cars are here and the fire trucks are here and the ambulances are here, they're in the parking lot, so that there's no reason to call 911 again. But if you know where you are, you need help, those are the people that can talk directly to the rescuers, so kind of getting information like that out there, that it's sometimes you're circling back, it's more of a process, and communication is always the first thing that breaks down.
Absolutely.
Things, And so, again, just giving people who don't have the radios and they're not the rescuers and they're not what, in it, you do have some access. And
even talking about things like signage with schools, right? Like you can, in informing the teachers or the staff members how they're relaying information to the dispatcher. So here's an example. Take whatever injury you want. It doesn't even have to be an active assailant, but we need help. We need emergency help in the Mrs. Smith's classroom in the kindergarten pod. Okay, that's a good start. Does the cop know where the kindergarten pod is and where Mrs. Smith's classroom is? And if the signage just reflects room numbers, when I get in a building, now if you didn't give me the room number, I don't know where to go from there. And so even some of those little conversations of like, how are things laid out in your school and how are we training folks to make those initial 911 calls to get us where we need to be? And that's part of the reason why bleeding control kits are so important to be decentralized, because with all of that time that passes, that's something that can't wait to be treated in a lot of cases.
Yeah, and timing absolutely is everything in these situations. So I'm just curious, what is kind of the most common mistake, I guess, when people are trying to administer first aid in a crisis?
That's a good question. I think thing number one, and this goes before, like let's rewind even before something happens, is having a mindset that you're capable of doing something, right? I think sometimes people don't want to think about what can happen or why, and it's I won't ever have to do that. That's not me. Somebody will be here to help me. And really reframing that of trying to figure out, okay, this may not be my professional job all the time, but how are ways that I'm going to be able to respond in some of those emergencies, and whether that's an allergic reaction or an asthma attack or an overdose, any of those things that are really time critical cardiac arrests with AEDs, is getting them in a mindset ahead of time that this is how we're going to be able to respond. Here are the ways that you're going to be successful. So a big piece of that is a preparedness piece. I think a second piece of that with emergencies like that are not getting distracted by things that can be overwhelming. And even emergency responders do that sometimes. We talk about things that we want to look for things that are life-threatening, not just
hurts the worst,
difficult to watch, right? And we call those distracting injuries. We call those, like, if you're injured, Colton, you may have a life-threatening injury, but if you broke your ankle and it's sideways, that may be the first thing that you tell me. So if I say, hey, Colton, what's going on? How can I help? And you're going to tell me all about that ankle. And I'm going to start to focus in on that and hone in on that. And that is, I'm sure, really painful. Sorry about that. Yes, that's not actually life-threatening, though.
Yeah.
So really identifying what are those life-threatening things. And that's why bleeding control kits are different than first aid kits. They're different because I don't want to sift through a bunch of Band-Aids and splints and tape, and I don't want to have to sort through that stuff to get to the really important stuff. So
yeah, no, because one of my friends is actually EMS, and I remember him telling me about exactly those things. Like, he'll see some, like, oh, arm is just all in a weird position, but actually there's like a bleeding that they're not really talking about, but he knows that location that's what we got to treat first, because the idea is just prolonging the life so they can actually get to the hospital.
Yeah, that's right. And bleeding control is, as Meg just mentioned, is one of those in that category of so time sensitive that often you have to intervene before EMS is going to have a chance to get there. That's why there was this big public health push for AEDs, because you don't have, the seconds that can count. And it's same with life-threatening hemorrhage. You can bleed enough to it not be compatible with life anymore in 4 minutes, and so you have to intervene in those sections, because even if the fastest EMS crew, the fastest police officer, is going to take some time to get there. I think something else that I don't know that we see it, but we get a lot of question about is liability.
Right.
Like people might take a stutter step about intervening, because what if they do it wrong? And then are they somehow liable for that? Or, we get a lot of questions, back when tourniquets first started to come onto the scene, like some years ago, generations above us, you learn that, well, if you put a tourniquet on, they're going to lose the limb. We get a lot of those questions in training. Well, I always heard if you put a tourniquet on someone, they're going to lose the limb, and I don't think that I want to be responsible for that. And there's a lot of research out there that shows that's not true. You can have a tourniquet on that's impeding arterial flow for many hours, and you can still keep your limb full function. But aside from that, in the States and here in British Columbia, there's laws that protect people.
Yes.
Good Samaritan laws that protect people against, as long as you're acting with good intentions and not gross negligence, then you're not liable for that. So that's another message we push out a lot, is we put these in public because we really want public to be empowered to use them, and to reassure people that there's no liability for, they don't face the same liability I might as a physician, or she might as a paramedic, being really cognizant of doing things right and choosing the right tool and choosing the right medication, those kind of things. Like Good Samaritans who are acting that way are protected. So I wouldn't say people don't make that mistake, but people might hesitate, and a lot of people have questions about, like, gosh, what if I do something and there isn't a good outcome? Am I going to be somehow in trouble for that?
Held liable. Yeah, that's tough.
Yeah.
Interesting.
Yeah.
So, when we look at Rescue in Color, where can basically folks are interested? They hear this, they see this, they're like, oh man, this is something that I need. How can they reach out?
Yeah, you can go to our website. It's just rescueincolor.com, and our contact information is there. We've got a web form there you can fill out that goes to our phones. So you're gonna get a hold of us directly, even through that web form. And we have some basic videos that kind of help share a little bit of, what we were able to talk with you today about the origin of it and kind of our development of that, and then give you an idea of the type of equipment and the color coding system that we offer.
Awesome. If there's one thing you wish every school in the country could implement tomorrow, what would it be?
I honestly, just from an overall overarching school safety, even outside of bleeding control itself, is relationship building. I think that the people that are in the structure, the people that are in the building every day with one another, if they have open and honest communication with one another, I think we could prevent a lot of issues, a lot of tragedies, and I think being open to communicate and building those relationships even prepare better when bad things do happen. So finding ways to build those strong relationships within your organizations, I think.
Yeah, I would echo that. As much as we're really on the, what we do, and the Mission Behind Rescue in Color is sort of on the far end of, now we're gotten through prevention and gone through the regular day, and now something has happened, and so here's the tools. We're kind of on this end of the, if something happens, God forbid, you're prepared. We really believe in prevention first, so I would love to see every school have, in addition to relationship building, to have robust behavioral health, behavioral threat assessment programs, digital threat assessment programs, because you have such an an interdisciplinary approach to preventing and getting people help, before something happens where they would need something like Rescue in Color,
Yeah.
So we've heard Teresa Campbell say a lot that she started Safer Schools together with the hopes that she'd go out of business, and we kind of feel the same way. Like we hope that nobody ever has to use. We want everybody to have our kits and never have to use them.
Hope they expire.
Hope they expire, and
Yeah.
all of this becomes a moot point. But I think that focus on prevention, especially getting so connected with the school safety community like we have, knowing how many amazing services and tools and minds are out there thinking about the prevention piece. I think that would be my wish, is that schools focused more on the prevention side of it, the relationship building, the threat assessment, engaging in that.
Yeah, I love it. It's so great. Every conversation we have, usually I just ask a general, open-ended question, and everybody, no matter from what discipline we come from, it's always about building relationships. It's always about open communication. So, Meg, Savannah, thank you so much for being a part of this conversation. Yeah. Absolute pleasure to have you.
Awesome. Thanks for having me.
Yeah, thanks for the invitation.
Sorry about my voice. I'm gonna feel better one of these days.
Yeah, absolutely.